Hi, my name is Pamela Moore, and I'm a doctoral student at California Intercontinental University. This presentation will review the case, making the problem as it should present it to the staff at Springfield General Hospital. I will start with an overview of the problem, followed by mentioning steps planned to change the current process, stakeholders to be included, and finally, the implementation process. First, let's start with an overview of the problem. The computerized physician order entry system has resulted in more prescribing problems than previously experienced. The patients and some nursing staff are unable to differentiate drugs with similar names. Patients have been given the wrong dosages, and this has led to patient confusion. These acts have significantly increased the cost of health care, which have increased the chance of discontinuation syndrome. Some steps planned in the change process. As we all know, technology should be geared towards reinforcing the existing awareness of the problem. The initial step should be considering starting with mutual involvement of physicians and other personnel in the diagnosis of the problem. The mutual agreement on change. The process of redesigning should be incorporated. Training and career positioning should go alongside the redesigning process. We will also be making changes to the software, such as including the name on the front and back of each form, changing the font and size if needed, and having different colors for mandatory information. Finally, we will ensure everyone is trained on the new system. Teams involved with the process. As we know, we all need teams. The teams involved in the process include information technology experts, physicians, nursing staff or team, and general managers. Information technology will automate the existing process. On the other hand, general managers ought to take relevant actions in ensuring coordination among processes involved. All teams will be considered stakeholders and trained on the proper processes needed to ensure a smooth transition. Next, we'll talk about sequencing the implementation to solve the problem. Automating the system will detect duplications, illogical doses, and allergies, as well as make drug comparisons. Developing the capability to view a patient's history and the largest clinical guidelines and the latest clinical guidelines for treatment is also essential and will also be included in the new software program. The staff will be trained for at least 4 hours on using the new software. A reward system will also be implemented based on behaviors to meet those strategic goals. Hopefully, I have answered all of your questions. If not, what are your questions for me?